feel that leading in the PICU is different than leading in other units, just because it's a tough place to work. We see a lot, we learn a lot, there's constantly things changing. So I feel like being a leader, I have to lead my staff holistically. I have to make sure that every, emotion is taken care of. A lot of times I go out there and you see nurses just, crying, like they're frustrated, they're tired, they're worn out, they're kind of at the end of the line and they don't know where else to go. And just offering that support and guidance to them really makes a difference and goes a long way, because they know that, that I have their back. And then in turn that they can give the support that they need to the patients and families at the bedside.
So leading in women's service is a little different because we're new. We're 5 years old now, but that's nothing compared to the legacy that Texas Children's has. So the difference is that other leaders want to keep their patients out, and that's positive. Ours is that we're always taking them in. We expect them to come. We don't know when they're going to come, so we have to be ready all the time. So we'll have days where we'll have 10 deliveries, but we'll have days where we'll have 26. That's the ability to be flexible and be nimble.
How I lead my team, I really just try and identify the areas that need growth, or someone may need some coaching or strengths talked to about. And so identify those areas, and I really try and encourage them and challenge them to then take those strengths and apply them to the area that they have at question. So really empowering them to be individuals in the unit and not just making it come from a leader. I try and let them be the frontline leaders as well of the unit, and really just empower them to have a voice and say in what we do.
As you know, everybody's a leader here. No matter what role you fill at Texas Children's, I think it's really important for people to understand that the decisions they make at the time, with the data that they have, the person that's in front of them, the family that's in front of them, I trust them that they're going to make the right decision in the moment. The expectation is you make the decision. And then if it's the right decision, it can always be better. If it's a decision that didn't go the way you thought it was, we're going to learn from it and grow from it. That our mistakes or our failures are really important to learn from. So I expect them to make decisions. Know all, but tell little. Know your audience, know your patients, have a sense of urgency. And if you do that, you can lead from that. I shouldn't have to tell you what to do every day, and I don't expect to, and I really don't. We have a fabulous team.
My favorite thing about being a nurse leader is probably getting to kind of be on the front line and helping to make decisions, and then being able to roll out those changes within the unit, and then just being there again emotionally for staff. I think it's really important that sometimes they just need somebody to listen to. So being that person that they can come and sit down and just be like, hey, I need to just talk it out. I love being able to be there for that. And even if on the weekends, somebody needs to call me or whatever, I'm always open and willing to talk to somebody for whatever they need, whether it's work related or personal related.
My favorite thing about being a nurse leader is that I'm a nurse. I think that's the difference in nursing and leadership, is that we serve the purpose of many. We think about how does it look if we sit at the table and give advice on maybe a large strategic plan, and then we're also thinking, what's that going to look like at 2 o'clock in the morning? Are we really setting people up for success 24/7, 365? That's very different than running a business that's Monday through Friday, 9 to 5. Or even outpatient. I mean, we don't have outpatient on the weekends. So their work is pushed together. We're always thinking, what's going to happen if something happens at 2 o'clock in the morning? And you only know that if you've been there at 2 o'clock in the morning. And I think that's really important. That's the best part of my day, being a nurse.